Well, we have Chris Regg, the director of the Ohio Senior Health Insurance Information Program, with us today. So, of course, everyone's need and medical situation might be different, but what are some basic things that people enrolling in Medicare should note this year?
Just check on what they have. There's really just two options in how you receive your Medicare benefits, either through Original Medicare, Part A and Part B, or through a Medicare Advantage plan. So knowing which program or which plan you have to start with is a great starting point. If you have Original Medicare, you may likely have a Medicare supplement policy and a standalone prescription drug plan. Or if you're in the Advantage plan, that's typically your one and only source of insurance.
No, a lot of times when we talk about open enrollment across the board, we hear about secondary insurance. What is that?
Secondary insurance implies you have original Medicare and there is a secondary insurance paying. Some may have an employer group plan or perhaps Medicaid if you're limited on income and resources. But very generally speaking, that typically refers to Medicare supplemental insurance, which is private insurance that pays after and only after Part A and Part B. And that type of insurance actually isn't limited to the Medicare open enrollment. During open enrollment, you're really choosing if you want to be an original Medicare or the Medicare Advantage program.
Here in Ohio, do you anticipate that you will have additional enrollees? Will we see those numbers increase this year in Ohio?
We welcome usually 100,000 new Medicare beneficiaries every year. So a lot of folks that need to make these decisions during the open enrollment period. And we're here to help.
And I know, again, this is a tough one to cover in a really short TV segment here, but what if you can't afford those premiums? You know, there's been a lot of data coming out saying that it's anticipated that these costs are going to continue to rise like everything these days. So what do you do if you just are thinking, oh boy, I don't know if I can make ends meet and pay this?
Yeah. First and foremost, we want to make sure that folks are looking at the most cost-effective options for their individualized needs. Beyond that, there are several assistance programs that can help. Medicaid has programs where you might have income and resources higher than qualifying for full Medicaid, but there's additional programs that specify to help with Medicare out of pocket. And also, Medicare offers extra help in paying your prescription drug copays. And we certainly want to screen everyone to see if they qualify.
Awesome. Well, Chris Regg, thank you so much for being with us today. Of course, just touching the surface here on all of the information that's out there, but we have a lot of resources for you, and we will continue to connect as that open enrollment continues.